was waiting 2 hours out there.
Fascinating. Let's see it.
You don't introduce yourself?
Hi, I'm Greg. How about that local sports team?
Just take a swab and get it tested, okay?
Sorry. Already met this month's quota of useless tests for stubborn idiots.
You're rude.
Wow, you're like a detective or something.
And you're smart. You treat everyone around like they're idiots. And you get away with it. Treat people like jerks. You get treated like a jerk.
Whoa! The best episodes of House when he goes up against someone who's actually a threat. Very excited to be reacting to House MD Season 3, Episode 5, Fools for Love. On this channel, we are reacting to all 177 House videos. This will be episode 69. Let's see if I can get the diagnosis before House does as a doctor working in London.
Hand it to me! Put him on! Wallet. It's on the counter, right now!
Son of a bitch, you thought I was gonna let you hurt my wife! Hey, mister!
Your wife.
Tracy!
Sudden airway collapse. Forget the robbers, she needs urgent medical attention. If there are signs of known allergy, then she needs to be hit with an EpiPen to the thigh, straight call to 999 and ask for help. To try open the airway, you'd want to do a head tilt, chin lift to remove any obstruction of the tongue in the airway. If the person actually stops breathing, then you need to start CPR to keep them alive until the ambulance arrives. 30 chest compressions, 2 rescue breaths. I think everyone should get training in basic life support in case you meet a situation like this in the future.
It's not allergies, negative on all the skin tests, 4 days of antihistamines and steroids. Patient has unexplained intense abdominal pains. They need a laparotomy. Liver, bowel, gallbladder, appendix, all clean.
There's pot on a tox screen. Salmonella from the pot would explain the stomach pains.
Start her on fluoroquinolone for the salmonella.
The medical accuracy of House never fails to impress me. Salmonella can actually be contracted from cannabis use. The connection happened after people around Ohio and Michigan had an outbreak of apparent food poisoning back in the 80s. When they tracked down the source, they realized that the common denominator was marijuana from Colombia or Jamaica. That wasn't the end of it though, as fast forward to today and almost 40% of cannabis products that are sold illegally actually have these bacteria. They just don't affect most people because they're either being burned or cooked or them having competent immune systems. It would be really unusual for salmonella to cause abdominal pain severe enough to have exploratory surgery, which this patient had, without it causing vomiting and diarrhea though. And now they want to give her antibiotics which will just cause diarrhea so they can say that it's the salmonella progressing. I've seen better plans from Improvised theatre.
And how about you yell out,
I was waiting 2 hours out there.
Fascinating. Let's see it.
You don't introduce yourself?
Hi, I'm Greg. How about that local sports team?
Just take a swab and get it tested, okay?
Sorry. Already met this month's quota of useless tests for stubborn idiots.
You're rude.
Wow, you're like a detective or something.
And you're smart. You treat everyone around like they're idiots. And you get away with it. Treat people like jerks. You get treated like a jerk.
Whoa! The best episodes of House when he goes up against someone who's actually a threat. The last time House met someone who tried to go head to head with him though, they got publicly humiliated. If any real doctor acted like House though, then trust me, the series wouldn't get past season 1. This series makes it out as well that hyper intelligent people have to be jerks, but that definitely is the exception and not the rule. I think part of why the writers do that is to balance the character's strength with flaws, because perfect is generally quite boring. At the risk of bursting Universal's bubble, a 2019 Stanford Business School study actually found that smart people are nicer and more cooperative than their less intellectually gifted counterparts because they know that being nice is very effective. Ultimately, the reason why we lifted ourselves out of living in caves and covering our genitals in cowhide is because we learned to cooperate, although some people still insist on covering their genitals in cowhide. That aside, I am dying to see how House is going to respond to being straight up assaulted by this guy. Let's find out.
Thank you.
Bend over. ever get that thing where you're sure you forgot something, but you can't figure out what?
This is getting spicy. I have a feeling we're going to see more from Rectal Thermometer Man. He doesn't seem like the kind of guy to turn the other cheek. House convinced the patient that he needed a rectal thermometer because he was chewing nicotine gum. What happened to the in-ear thermometer? There's also a laser thermometer as well, but they're about as accurate as your star sign. Question for you smart people. How did astrology start? Answers down below.
We don't do a lot of drugs.
I need to know your answers aren't being pressured.
He's a good guy. He just has a hard time holding in his emotions. Itchy.
Allergic reaction to the fluoroquinolone.
We can't treat the salmonella unless...
Salmonella? That was a total stretch.
Exercise-based anaphylaxis?
Give her the same food she ate at the diner and stick her on the treadmill.
House thinks it's exercise-induced anaphylaxis. It literally makes you allergic to exercise. Death by squat. So Mother Nature must have been having a bad day when making that condition. Now House wants to recreate the scene in the robbery by giving the patient the same food and exercise. The partner must be a clue here though. He has trouble controlling his emotions, really went all out Rambo rage when he had a chance with the thieves, and it started seeming pretty aggressive with Foreman. Maybe whatever she has, he has as well, just not quite as advanced. In that case, it would have to be either an environmental cause or an infectious cause. The episode is called Fools for Love as well, so I'm liking this theory. Triggers could be common things like nuts, dust, or shellfish. Spicier house-esque causes could be poison plants, chemicals, or molds potentially. I would definitely want a patch test on this patient, and when someone has suspected anaphylaxis like that, you can check the level of mast cell tryptase to see if they were truly having an allergy-mediated reaction or something else entirely. Of course, that'd make it way too easy though.
Tracy, I'm increasing the speed a little.
My stomach really hurts.
You're just hurting her. Ow! 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 My stomach and my chest.
Married couple, same disease.
Infectious or environmental?
Box of condoms in his jacket. She's on the pill.
Oh, this husband was involved. The condoms while she's on the pill could mean one of three things as well. They both have a latex allergy and just love suffering. He's cheating and has an STI which he gave to her. Or one of them knows they have an infectious disease like HIV and was trying to limit its transmission. It's important to clarify though that HIV treatment over the last 2 decades has massively improved. Now we can suppress the load of the virus to undetectable levels, so it's safe to have sex with someone with HIV without protection if they've been taking their treatment, and 2 undetectable viral loads recently. So many people are understandably cautious about this. Interestingly, there's been a massive campaign of undetectable means untransmissible recently, but a large study from 2021 showed that around 33% of patients with HIV can have some degree of recurrence of virus, even when a test showed levels were undetectable. The vast majority of those had the test more than 6 months earlier, so if the 2 consecutive viral load tests are recent and the last one was within the last 3 months, then that is pretty reassuring. Still, taking precautions with condoms though is definitely a good idea if you want to be certain.
We show that to House, he'll just call the guy a cheating bastard.
That cheating bastard.
Gonorrhea explains all their symptoms.
The NAATs were negative. They don't have an STD.
He wants to kill you. Shoving objects into their rectums is assault. Apologize to the guy.
What are you doing here?
Stay away from my son. Stay away from that girl.
Probably would have taken the gonorrhea over this father-in-law. The Trojan that helps with gonorrhea is much easier to source. There have been some themes of interracial tension here, with the patient's husband accusing Foreman of not liking him because he's white. Maybe this is because the husband is paranoid about it. His father doesn't approve of their cross-cultural union. I find this topic interesting as I'm Arabic and I've married a Finnish woman and wouldn't want it to be any different. Interestingly, since this was filmed, the rate of intermarriage has increased in the US by about 33%, with some massive recent spikes. What's really interesting though is when you break down the data, you notice that it's increasing for every race except Asians. It's unclear exactly why that is, but it does remind me of a story of a friend. He is an Indian guy wanting to marry an Afro-Caribbean woman that he'd been with for the last 5 years. After introducing the girl to his mom, the mother said she'd rather that he be miserable with an Indian woman than marry someone from a different race. Obviously, not all families have that mentality, but it could be an indicator of why these rates are as they are. What's even more interesting though is if you split the Asian subgroup numbers up even more, then the majority of the decline in intermarriage rates has been in those who have a high school education or less. So is the intermarriage the reason for this stepfather's intolerance, or does he even exist? Let's find out.
She's dreaming. She started yelling. Baby, it was just a bad dream. Everything's okay.
It was an acute delirium. She's in a coma.
I think it was about my dad. He was a drunk, pill-popping racist. He killed himself a couple of years ago.
Some generalized edema throughout and areas of increased signal here, here, here.
Husband's chest. He has slightly enlarged hilar lymph nodes. Sarcoidosis explains almost all of their symptoms.
Interesting, so House is adding up both of their symptoms together. So what do we have so far? Hallucinations, coma, lymph node enlargement, abdominal pain, chest pain, and throat closing up. I think those symptoms are in keeping with some type of lymph node condition. House thinks it's sarcoidosis, but I think that's too obvious, and the episode title is Fools for Love. Maybe the husband is working late and they have no family around, so the wife decides to get a cat. Cats are furry and cuddly, but they're still predators of some of the most disease-ridden animals, rodents. See, by eating them, they can get infected with a parasite called toxoplasmosis, which they can then release in their poo. That can mess up with the love centers of people's brains, but usually not for other people, but for actual cats. You get toxoplasmosis for cats, and it makes you fall in love with them. House loves ironic diagnoses, so this is worth a diagnostic guess. If you're enjoying my mad theories to this episode, then check out the channel membership. You get access to exclusive perks like priority access to new videos, exclusive polls, and being able to suggest a series and episode for me to react to. The first 30 members have a chance to win a 1-hour, one-on-one tutor session with me on a topic of your choice, and we currently have 26 members with just 4 spots left, so join now to secure your spot.
Start them both on methotrexate. We'll biopsy her just to be sure.
You can't do that to her. Do it on me instead.
It's not in your brain.
You poisoned your wife. You don't want the coppers to get wise.
No, he is the love of my life.
She's in a coma. Who are you trying to impress?
House is so cynical, as if people can feel those little nuisances he keeps in mental Azkaban called feelings. This guy does seem to be highly emotional though, and it just has to be a symptom as they focused on it so much. Nothing in House is included by accident. Now we know the main control centers of emotion are the limbic system of the brain that was triggering heightened emotion there. Then that could explain the symptoms. Maybe it was a viral infection that started in the upper airway, causing her anaphylaxis and the abdominal pain. Then it spread to the brain and led to limbic encephalitis. That would be my second diagnostic guess. I do hope it's that, as it seems this gent struggles to regulate his emotions, and that does remind me of a study published in the journal Emotion back in 2010. People who know how to regulate their emotions end up being more successful, have higher incomes and social status. For me, it's about doing what I need to do or what's best for the situation despite how I feel. A good example is maybe something a patient says makes me angry, but I still need to set my feelings aside and try and help them. Like the other day, one patient opened the door and looked confused saying, "You're a doctor?" I said, "Yes." She then said, "Really? You're not a student?" Maybe she had a bad experience in the past that led her to act like that and be more cautious. Maybe she was suffering from a condition and needed to know that I was qualified to deal with it. Maybe I do look young for being a doctor. Ultimately, we can't control how other people act or what they say. One book that was really insightful for this particular issue was the international bestseller, The 4 Agreements by Don Miguel Ruiz. One of those agreements is don't take things personally. People act how they act because of them, not because of us. When people insult you, then it's likely due to how they're feeling and their personality, but similar is true for when you get excessive praise as well. The best thing is to have an intrinsic idea of who you are and what you stand for and take constructive criticism, but leave the rest. If you're interested to find out more, you can get the book with a free trial of Audible Premium Plus. I'll put the link in the description. By following that, you are also helping to support the channel for free, so thank you for doing that.
I need a court-ordered biopsy of this woman's brain.
Speaking of litigation, Michael Tritter.
I want to beat the crap out of you. You're a bully. I'm looking for humiliation.
I'm not apologizing. If anything, you deserved a bigger thermometer.
Jeremy's worse. Lactic acid's up to 39. His intestines are rotting.
Lactate of 39 is off the scale. I've seen patients who've just been revived from cardiac arrest with lower numbers. And lactate is produced when the body can't oxygenate their tissues enough and they switch from aerobic respiration, which uses oxygen, to anaerobic respiration, which doesn't. But speaking of patients being revived, it seems like House may need to be revived soon himself, as Tritter over here seems like he doesn't just want revenge, he wants House to suffer. So much so that he never tries to embarrass a patient again. We all love watching House, but it is about time someone called him out for being about as soft as a zombie knife with his patients. I mean, he has the bedside manner of a pathologist, or maybe a surgeon. Once I met a surgeon on cardiothoracics that had such poor bedside manner that he refused to see patients except on the operating table. He had his juniors do the consent and clinic procedures and he would just cut. If patients asked to see him, then they were warned against it, even if it was just to say thank you. The reason why I remember this though is because it is very rare to have someone like that, and usually they're so skilled in the cutting department that they manage to make up for the very deficiencies that they have, if you even can make up for those. I don't think you can. Now, why is this patient's bowel rotting? What if he has HIV that has progressed to full-blown AIDS and his bowel is getting trashed by a disease called necrotizing enterocolitis, which is a bacterial invasion of the intestinal wall? It usually affects babies who sadly get HIV from their mothers, but could affect him too, although it would be very rare. It could also have affected her if she got HIV from him and made them susceptible to opportunistic brain infections like progressive multifocal leukoencephalopathy. Let's get more clues. This is a really tough one.
He's gotta have ischemic bowel.
Take out the dead bowel.
Bowel's not dead.
She has pretty eyes. Defective DNA is keeping them from making a critical protein. Hereditary angioedema. These two have green eyes. Half brother and sister. Dad must have had an affair with her mom. Start treating and see what happens.
The couple have the same dad! Wake her up from the coma and she'll be back in soon after she hears that. This reminds me of a case that happened around 5 years ago in the US. A Mississippi couple discovered they were not just siblings, but biological twins after they had fertility testing since they were having difficulties getting pregnant. They had both been adopted as kids and had no idea they even had a twin. So much for opposites attract. House here though is saying they must have been related because they both have hereditary angioedema, but it isn't as rare as you might think. There's a 1 in 60,000 prevalence and it's caused by a gene mutation in a protein that regulates the immune system called the C1 inhibitor protein. It's treated by replacing the protein, but it's very expensive to extract and it needs to be given regularly. Your normal steroids and antihistamines don't work as they don't deal with the root cause of the problem. House got all that from her green eyes and the patient's dad not giving his blessing for their union. I really need to try harder if I'm going to be him, but maybe it's not over.
I almost hope she stays in a coma.
Tracy, she's awake.
Tell them, or I will.
We think you have the same dad.
Oh, God. Everyone always talks about how we have the same eyes.
We just destroyed 2 people's lives. Want me to hang out here a bit?
If you'd actually read my chart, you'd have known that I'm a cop. You took a pill while you were examining a patient. That's serious addictive behavior. Got a prescription? Oh, I bet you didn't bother. You are under arrest.
Oh, House messed with the wrong patient. He's gonna spend the night in a cell for it. Very excited for the next episode. The nurse Wilson was romancing is actually getting with Foreman. That's how he knew they weren't together. Seems like the main couple couldn't get past their genetics of being half brother and sister, which probably is for the best. I've seen so many children of cousins with syndromes who are suffering, so siblings ramps up that likelihood of genetic abnormalities even more with the narrower gene pool. This episode was very good. It's an 8 out of 10 entertainment, 6 out of 10 accuracy, with 7 out of 10 diagnosis. This makes way more sense though when you watch the previous one where House sees himself in a boy with autism. Right here.